I'm Dr. Jeff Smith, author of the book Living Pain-Free, It's Your Choice. Now you heard what I said. I literally wrote the book on how to live pain-free. If you have neck pain or back pain and you just can't seem to get rid of it, if you've tried pills and medications and doctors and chiropractors and physical therapy and massage and it's still hanging around, there might be a more serious condition that your doctor hasn't found yet that will eliminate those problems. We're here to tell you a little bit about what we do in our office that makes us so different. How do we end your chronic health care condition? How do we get rid of chronic neck pain or chronic back pain? Well, we're going to look at our patients and treat them both metabolically, neurologically. Now, what does that mean? Metabolically means we're going to look at certain blood tests. Certain tests that will tell us what's happening inside your body. If you have neck pain or back pain, you better believe it's affecting things inside of you. No stone is left unturned when we evaluate you. We're going to know everything about what's going on and, more importantly, what the cause of the neck pain or back pain is. Not just the symptoms, what the cause is. Okay? We're going to run metabolic panels. We're going to run a thyroid panel, a complete metabolic panel, a lipid panel, and a CBC with autodifferential. Now, why are those blood tests important for neck pain or back pain? Well, number one, patients tell me all the time, "Doctor, I had the test, they said I'm fine. Everything works fine. I'm within the normal laboratory ranges. The doctor said nothing's high, nothing low, I'm fine." Well, on that sheet of paper that you get with your blood results, it says what the normal range is for thyroid, as example. It says 0.5 to 5.0 is normal for thyroid. Your doctor looks at your blood test and says, "Oh, you're a 1.2. Well, 1.2 is definitely within 0.5 or 5.0. You must be normal, right? Wrong. The functional normal for thyroid, or in other words, the optimal normal on that sheet of paper, is 1.8 to 3.0. If you're 1.2, you're hypothyroid. You're low thyroid. Now, why is thyroid important? Well, in pain, specifically neck and back pain, if you have a low functioning thyroid, you're going to have problems sleeping, you're going to have problems with pain, you're going to have problems with weight gain. And you're not going to have enough energy. So even if you are in pain all day, you won't have the energy to get up and move around anyway. If your doctor doesn't know to take the right test, and more importantly doesn't know how to interpret those tests right, you're never going to get over that condition. Okay? We do sensitivity testing on our patients. Metabolic sensitivity testing. What does that mean? Well, metabolic sensitivity testing means we're going to test you for sensitivities to wheat, gluten, soy, milk, eggs, and yeast. Now, why would that be important? Well, if you're sensitive to any of those items and you put them in your mouth, it's going to cause a terrible, terrible reaction. For instance, it can cause chronic pain or chronic fatigue just from the type of food you're eating. It can cause frequent indigestion. It can cause bloating in your stomach after you eat where you just feel blah. You can have frequent loose bowel movements, or the opposite of that, which is chronic constipation. Okay? It can cause ulcers in the mouth. It can cause sores in your mouth, or it can actually cause you to vomit, all from being sensitive to certain food items. If your doctor doesn't run the tests on you to find out if you're sensitive to those things, and you continue eating those things because you don't know any better, your neck pain and your back pain is going to be that much worse. Okay? Adrenal stress index. That test tests your adrenal glands, which sit right on top of your kidneys. Your adrenal glands are really important and the main thing in your body that helps you deal with stresses like pain. If your body can't deal with that because the adrenal glands don't work, you're going to have more pain, more neck pain, more back pain. That test tells me whether or not you have adrenal problems, whether or not I need to work on them. Okay? Autoimmune disorders. What does that mean? Well, Is your body attacking itself? Is your immune system so out of whack that it's attacking itself, causing pain in the neck or back? Do you suffer from an autoimmune condition? How do you know if you do? Well, you run the tests. Your doctor's got to test you. For example, in the thyroid, there's two antibodies called TPO and TBG. If those antibodies are too high, you're suffering from Hashimoto's disease, which is an underfunctioning thyroid causing an increase in pain and an increase in fatigue. If you have that, do you think it's going to make your neck pain or your back pain worse? You bet. Your immune system could be attacking your nervous system, which would actually cause pain or numbness. The only way to know is to run the test. We run tests like lymphocyte subpopulation, Th1 and Th2 cytokine panels, natural killer cell activities. Those tests give me an in-depth picture of what exactly is happening inside the immune system. And more importantly, if you have an autoimmune condition, it trumps everything else that's wrong with you. It's more important than the neck pain or the back pain anyway. Because if it doesn't get addressed, you'll never get over the neck or the back pain, no matter what treatment you have. We need to test the gut, the Helicobacter pylori inside the stomach. Because if that gets out of whack, what happens is it causes intestinal permeability. What is intestinal permeability? It's when your gut leaks. Your intestines leak fluid out. Leak all the bacteria and the toxins out into your system. Like when your appendix bursts, you get so sick. Well, if you have leaky gut syndrome due to a damaged bowel lining, it causes more pain because of the immune reaction in the system. Your immune system goes haywire. So if you have neck or back pain, it's going to make it 10 times worse. Neurotransmitters. Those are the chemicals in the brain that help conduct signals to all the nerves in your body. If you have no neurotransmitters or decreased neurotransmitters, it actually causes an increase in pain. More pain. How do you know if you have that? You run the test. Hormone panels. Male and female testosterone. If you don't have enough of that in your system, you can't fight off pain anyway. No matter if it's neck or back pain, it doesn't matter. You can't fight it off anyway. Okay? Inflammation. There's a protein in the brain. It's called C-reactive protein, CRP. If that protein is too high, essentially it causes swelling and inflammation inside your brain. Not only will that make pain in the neck and back worse, but it can literally kill you. How do you know if you have that problem? Your doctor's got to run the test. Glutathione. Do you have enough glutathione in your body? Well, what's glutathione? Well, nothing really. It's just the most important antioxidant there is on the planet. And if you don't have enough of it in your system, you can't fight off any disease anyway. It can only be taken, glutathione, in 3 ways. Suppository, via nebulizer, meaning you breathe it, or with a cream. We use a cream in our office because it's the easiest thing to do. If your doctor's smart and tries to give you glutathione with a pill, run. It won't be absorbed into your body. It won't do you any good because your doctor doesn't know any better. Okay?